So, hello everyone. This is Dr. Kevin Bethel at the Family Wellness Clinic in Freeport, Grand Bahama. I'm here today with a good friend of mine and mentor, Dr. Halasa, who is the president and founder of the Chronic Disease Prevention and Management Group and Fellowship Training Program. I am just completing today some of the training for the fellowship program on using nanoparticle delivery of medications. So I am actually right now receiving medication, just vitamins and stuff right now to help me for a little issue that I've had in the past week as part of the training. But they're delivering the medicines with my own nanoparticles that are produced from my own platelets. All right, so this has very important ramifications and uses that I'd like Dr. Halasa to explain. So can you tell us a little bit about what your role is with the chronic disease prevention and management, and then tell us a little bit about nanoparticles and why they're so important.
Yes, so basically I am the founder of Chronic Disease Prevention Management Centers, and we have centers all over the world. We're setting up a center in Bahamas with Dr. Kevin. And yes, the center will be addressing all kind of chronic disease, so your clinic will become a chronic disease prevention management.
Yep.
And we use nanomedicine as a way to deliver drugs into the pathology. It's called target therapy, nanomedicine.
Mm-hmm.
I think all the drugs of the big pharma supplements that are moving to that direction using synthetic nanoparticles,
yep,
which will help to deliver the medications and supplements into the pathology and minimize the side effects, increasing its efficacy. The idea is that instead of using synthetic nanoparticles, we can extract your own nanoparticles carriers from the platelets, which contain also growth factors. And so we take the blood, and we spin it, we take the platelets, and we break it down with sonications, and then we load them with drugs and nanofilter it. And eventually, we can get these medications to the pathology and minimize getting it into the healthy tissue, so you can get better effect in treating the pathology itself. In your case here, you have some reactions to the vaccines, some vasculitis, and I think we are now putting nano supplements, right?
Mm-hmm.
All the platelets, the exosomes, and hopefully this will help to alleviate the inflammation that you have.
It certainly has.
Yes, and especially use methylene blue as
Yeah,
well.
I wanted to mention that too.
Right, and of course it's not just for IV applications. You can do it injecting to the joints. You can nebulize it, intranasal it, and this nanoparticles, which is derived from the platelets, will carry those drugs into the pathology, increase its efficacy, of course. As we said, the big pharma is already doing it with cancer drugs. They have Doxil instead of doxorubicin, which is doxorubicin loaded inside phospholipid nanoparticles. The problem with that, they get trapped into the macrophages of the liver. So instead of getting into the pathology, they get cleared by the macrophages of the liver. Platelet-derived exosomes does not cleared by the macrophages of the liver because it's autologous, it's on your body, it's like autogen, and it gets into the pathology without being hindered by the macrophages of the liver. So that's the advantage of platelet-derived exosomes versus nanoparticles, that's synthetic. And I think we can use it for different kind of applications. We can manage all kind of chronic disease using the nanomedicine, and we can use it for increasing the sensitivity of the antibiotics to the bugs. If you have resistance to the antibiotics, you can increase sensitivity of it and break that resistance using nanomedicine. That's one way. You can use lower dose of cytotoxic drugs of the cancer instead of using the full dose, and still get the better effect than the naked chemotherapy. And there's many applications, and the whole purpose here is to increase the delivery of the drugs and supplements into the pathology instead of going everywhere and causing the side effects, especially damaging the healthy tissue that you don't want when you use especially the cancer drugs.
Yeah. So I wanted to thank you for coming, but more importantly, I want to explain that we've done more with the training, you and I, over the past 2 days. We've done photodynamic therapy. So I'll explain, because I have to best summarize this. When we say we have skin in the game, and I actually was having a adverse reaction to the COVID-19 vaccine. I won't give you all of the things, but it was very real. I was very sick. And I used a treatment that Dr. Halasa introduced me to called methylene blue and used a laser photo activation of it. And within hours, I was feeling significantly better, all right? And part of that is then also now to do what we just talked about with the nanoparticles, but treatment of chronic disease requires, there's no magic bullet, no magic trick. It's a comprehensive, individualized, personalized approach. But what we're talking about is using your own platelets to take the medicines that you would normally be taking for these chronic diseases and making it super personalized, packaging it in your own blood cells, membranes, so that they can get delivered to the areas of the body that need it. And studies are showing, as Dr. Halassa has shared, that, for example, if you give medicine intravenously, an antibiotic, maybe only 1% or less of that medicine actually gets to the area that we want it to go to treat the infection. Ditto the same thing if we're talking about tumors and cancer. Now, if you nanoparticleize it with synthetic particles, you may increase that a couple percent. But when you package it in your own platelets, you're getting as much as 50% of the dose delivered to the target tissue, which is a huge factor of difference. So this is why we're able to actually use a smaller dose and get better effect. Because if I use 100 milligrams of a medication and only 1 milligram actually gets to the target that we want it to get to do what it needs to do, but here I use 10 milligrams, but 50% gets there, that means 5 milligrams actually get there with a smaller dose. So less chances of side effects. And so I'm speaking from personal experience about what the power of this medicine can do, all right? It very well may have saved my life, all right? I was very sick, all right? I'll maybe give a separate testimonial about that experience, but I still think I have to live through it because I'm still dealing with it. But this has come a long way. And it just so happened that Dr. Halassa was previously scheduled to come here for this training. So God works in mysterious ways, and I thank you for coming.
Sure.
And I want to invite anyone who's listening to this video to please ask if they have a chronic disease. So you know what chronic diseases are: chronic obstructive lung disease, diabetes, chronic congestive heart failure, dementia, you name it. All of those things, we potentially can have applications to help you recover from those things. So please ask in the staff. So we'll be happy to explain to you, maybe give you some literature, more explanation about some of the techniques that we've just described in this video, and much more that we may be able to help you with. So thank you.
Thank you very much.